Hi everyone, my name is Dr. Chiara. I'm a licensed psychologist and this is my YouTube channel In Session. Today I want to talk about a question that I get asked very often from students that I work with, the master's students, and that is, should I get a PhD? And I find that there are students who have many different ideas around what they want to do with their degree. So there are some students who enter the program knowing they want PhDs. There are some who enter the program intent on getting the master's and are considering the PhD. And then there are some who don't even realize that they want it until they start talking to other students about it or other professors. And so I end up having this conversation a lot with students and I really enjoy having them, so I wanted to offer it on here as well. Okay, so first, one of the things that I wanted to talk about was why I wanted to get a PhD, and that's normally the first question that students ask me is what made you want to do it? So I'll share that with all of you. So the reason why I wanted a PhD was in my master's. As much as I knew I loved clinical work, and I had no doubt that I was going to love clinical work, I could see how much of a toll it took on people to be working 9 to 5 as a therapist, whether that be at a community mental health clinic or a college counseling center or even in private practice. Having 35 hours a week of clinical work, which is very, very high, I will add, just felt very hard, and it felt like something I didn't want to do. And for me, a PhD meant that I could diversify the work that I do. I will also add, though, that what I'm finding is that it is typical for folks in private practice to have a full caseload, about 25 to 30 clients. So it's not like you're seeing 40 people every week, right? But you're only getting paid for those 25 to 30 people that you're seeing. And so I knew that I wanted to do clinical work. I just didn't want to do 25 to 35 or even 40 hours of clinical work. I say, though, that I don't believe that this is a good reason to get a PhD, though, because I have seen really great examples of clinicians that have decided to stop their formal education with a master's, and I've been really inspired by what they've been able to build with their career. So I'll name some quick examples, but Kenya Crawford is one that comes to mind, Kelly McKenna, who's really big with the business of therapy. There's another Kelly, I'm forgetting her name, but she's also someone who's the private practice pro, right? So there are lots of people who are really making a really cool career for themselves just with a master's. So take what I'm about to say with a grain of salt, but that was a big reason for why I wanted to do it. I wanted to have more options in my career. So I think that with a master's, you can actually do a lot of what you could do with a PhD, with few exceptions, right? With those exceptions being working with assessment and neuropsychological testing. So there are always exceptions to work that is unique to PhD level. However, what I now say to students is that while I think you can do many things that a PhD can do with just a master's, I do think that the doors are more easily opened with a PhD. Having those 3 letters after your name, whether it's PhD or PsyD, I think makes a difference. I think that it establishes credibility, it establishes that you are very well trained and that you have received extensive and rigorous training, not only in clinical work, but in scholarship and research. That very much informs the way that you do clinical work. And I think that it just demonstrates to folks that you know what you're talking about for the most part, right? Obviously, there's always going to be exceptions. But overall, I think that the doors are just a little bit easier to open with a PhD. So that's part of the reason why I wanted to do it. And I also really wanted diverse training experiences. So I had worked at a mental health counseling clinic during the second year of my master's, and I thought it was a great experience, and I really loved that site, and I really loved my clients. But one of the things that's really unique about a PhD is that every single year that you are in training, you are working at a different site. So my first year of the PhD, I was in another community mental health clinic. My second year of the PhD, I was at a college counseling center. Then I was at a Veterans Affairs hospital. I was at the Brooklyn VA. Then I did another year at the Brooklyn VA. I also did a virtual externship with the New York State Transgender Identity Program, which provided gender affirming and trans affirming services to folks that are incarcerated throughout New York State prisons. So I did that during my third year. I also worked very, very part-time. It was like 5 hours a week at a private practice, which that was actually my only private practice experience throughout my entire PhD, right? I have lots of training, lots of clinical experience, but I didn't get private practice experience until my third or fourth year of the PhD. Whereas in a master's program, what I'm realizing as I work with a lot of master's students is private practices are actually one of the most common places to end up working, at least in New York, because there's so many of them. So a lot of students will end up working at private practices. So I've just really liked the idea of having lots of different kinds of training. I wasn't only working with college students or folks that were veterans. I was working with so many different kinds of presentations and so many different kinds of ways of thinking about how to help people and how to support people and whatever was bringing them to therapy. And I learned lots of different modalities, and I got exposed to so many different kinds of supervisors. In fact, in my last year alone, in my last year of training in psychology is referred to as internship, and it's essentially residency, but for psychology. So during my last year, I had 3 major rotations: health psychology, inpatient unit, and PTSD. And within all of those rotations, I had several supervisors helping me hone in on a very particular theory within each of those rotations. As I reflect back on that year, I realized that I actually had 15 different supervisors in that one year, and I had a different supervisor for every different kind of modality. So that would have been a CBT supervisor, an ACT supervisor, a psychodynamic supervisor, a PTSD supervisor. So through PTSD, I had a supervisor for cognitive processing therapy, I had a supervisor for prolonged exposure therapy, I had a supervisor for PTSD evaluations. For health psychology, I had a palliative care unit. I did diabetes management, diabetes support groups. And in inpatient, right, I got to experience and work more closely with severe mental illness. So I worked more closely with schizophrenia and schizoaffective disorder and bipolar 1, folks that were actively manic. I worked with folks who were actively or chronically suicidal. And so with a PhD, you're just getting so much experience at so many different kinds of sites, and you learn a lot, right? And so if you are someone that's excited about learning, that's excited about being exposed to different kinds of theories and different ways of doing the work, I think a PhD could be a good option for you. So that was the big reason for me, is that I was really curious. And so I took that curiosity as a sign that I wanted to learn more. And a PhD was a really easy way for me to learn more. Or not easy way, but it was, a surefire way for me to learn more. And then finally, one of the things that comes up a lot when I talk to students is students liking the idea of being called Dr. So-and-so, and then a little bit of shame or guilt in that, that shouldn't be a reason for pursuing a PhD. And to that I say, should it be your only reason? No, but I absolutely think that it could be a reason. For me, it was. I'm a first-generation college student, and for me, it was a big deal to be able to say that I got through a PhD and that I was able to work hard enough, plan enough, have the motivation to get through the really tough moments throughout a PhD, have the discipline to continue working even when I didn't feel motivated, right? Because there's a difference between discipline and motivation, particularly in a PhD, right? And I think this is something that's also really important, is that you're not going to feel motivated the entire time you're in a PhD. And I think that's one of the biggest lessons that a PhD has taught me, is discipline. And it's something I still work on, right? I don't have discipline in everything in my life. I was supposed to go to the gym today and I didn't do that. And so we'll see if I go later today. But I think one of the things that a PhD teaches you is how to motivate yourself and how to get things done and how to work towards your goals, even if you don't feel like it, right? Because you're tired during a PhD, you're working a lot. There's been a couple studies now, I'll post some screenshots here. There have been a lot of studies that have now spoken about the mental health of psychology graduate students because of how intensely we're training, right? So we're not only doing research, we're also doing clinical work, we're taking classes, we're course assistants for classes, we're working part-time jobs, right? Almost everyone that I know in my program had some other type of job that they were doing. And so I think it's important to recognize, right, that it's a lot of work and it's hard, and I by no means want to downplay how hard it was, and I got so much out of it, and I'm really proud of what I did in order to actually get the PhD. Okay, so what I'm gonna do is I'm gonna give 3 reasons for why I think it would be a good idea for someone to pursue a PhD, and 3 reasons why I think it would not be a good idea. These are just my opinions. Please talk to other people, right? This is, I think, one of the biggest things I say to students. Get different perspectives, talk to other PhD students, talk to other psychologists, figure out and learn about the differences between clinical and counseling, and I'll probably make a video about that separately, just because that's another big question that I get asked from students. But talk to other people. These are just my experiences. Okay, so the first reason why I think a PhD would make sense is if you are someone who has interest in research. What I hear from students all the time is, I love the idea of getting a PhD. I love the idea of learning as much as you do in a PhD. I just don't think I like research enough to do a PhD. And so that is when students often will pursue PsyD programs. And to that I say, yes, you absolutely need to have an interest in research, but I don't think that you need to be someone who wants research to be the main focus of your career. I think that research is, at least in my program, I would say it was pretty 50-50 in terms of the level of training that we got in being clinicians and in being scholars. I felt like my time was very evenly divided in terms of where my energy and time was going in developing my skill set as a researcher and developing my skill set as a clinician. But I knew very early on in my program that I was not going to be someone who was fully investing my career into research, just because I didn't love it as much as some other people did, which also informs the decision that I made with my career now. I'm not tenure track right now, and that's intentional because I feel like I would have to have a lot more of a passion for research than I currently do to pursue a tenure track position. And so I love my current job, and I'm very happy at my current job because it allows me to do research. I don't do it to the extent that a tenure track professor would, but I also get to have a full private practice and do consulting and teach and mentor students, right? I have a lot of flexibility in my schedule, and I really love that. So yes, you do have to have an interest in research, but it doesn't necessarily mean that you need to be just, like obsessed with research. Get really clear on what your research interests are, right? I will talk about that later in terms of how to make sure that you're competitive for PhD programs. And the number one thing is getting really clear on what you're interested in. And then also getting experience that shows the faculty that you're trying to apply to work with that you have experience working in research, right? It doesn't even necessarily have to be exactly within psychology. I worked in women's health with a nurse practitioner, and she had a PhD. She did a lot of research around trauma-informed care. And so we did a lot of psychology adjacent work, but it wasn't psychology. And so any research experience is good experience, but you need to have research experience. That's the big thing for PhD programs. Okay, reason number two, which is what I mentioned earlier, you want to train in a lot of different kind of sites, and you want to learn how to provide care to many different kinds of presenting concerns. So you're not only learning how to work with depression and anxiety and adjustment disorder and trauma, but you're also learning how to work with bipolar 1, bipolar 2, personality disorders, schizophrenia, psychosis. You're learning how to work with OCD, you're learning how to work with social phobia, you're learning how to work with panic attacks, right? There are so many reasons why a person seeks out help, and you're not gonna learn how to effectively help all of those people in only 2 years. In fact, I don't even think you learn how to effectively help all those people in a PhD program, because there's just so many different kinds of ways of helping someone. And it also will depend on the person in front of you, right? It's not just following a manual or following a book about how to work with anxiety or how to work with depression. You get trained in how to meet the client where they're at and provide care in a way that is aligned with evidence-based treatment, right? That is aligned with what the research is saying is very helpful in treating this particular diagnosis. But you're also learning to listen to the client, right? You're learning to listen to what they need rather than just what academia tells you what they need. So yeah, so that would be the big one, is you want lots of different experience. And I think a PhD is a really powerful way to get that experience. And then the third reason that I think would be a good reason to pursue a PhD would be if you are someone who's interested in teaching. I would not be able to do the job that I have now without a PhD. I could be an adjunct in a group supervision course, right? So at Teachers College, all the master students in their second year, they are working with either social workers or licensed mental health counselors who are leading group supervision and are teaching the class that helps students learn how to document and conceptualize clients and diagnose, right? And so that class is very important, and those professors play a very big role in students' development. But for the most part, in order to be a full-time faculty member, right, in order to teach a lot of the classes that I'm teaching, what I'm finding is that you do need a PhD in a lot of these places. And so just something to keep in mind, if you're interested in teaching, whether it's tenure track or non-tenure track, a PhD is usually what you need. All right, so those are the three reasons why I think a PhD would make sense. You have interest in research, you want lots of different kinds of experiences and training opportunities at many different kinds of sites. And number three, you want to teach, right? And you're excited about the idea of pedagogy and curriculum, and cultivating spaces in the classroom where students feel comfortable learning and taking risks, and being able to cultivate a new generation of clinicians. Those are 3 reasons that I think would be really good for pursuing a PhD. All right, so now I want to talk about 3 reasons why I think it would not be helpful to pursue a PhD. Number 1 is the money. Depending on the program that you get into and the programs that you apply for, a PhD can be very expensive, and it's not even just about funding and the amount of funding that you get, but oftentimes the stipend that you get in a PhD program, even if you are fully funded, is not enough to meet all living expenses. And so you are either working or taking out more loans. I had already taken out so many loans from my undergrad and my master's, and so I didn't take out any loans during my PhD, and it was fully funded. So I don't owe anything for my PhD, which I feel very fortunate about. But I owe a lot, like over 100K. I will just name it because I'm pretty honest about it. I think it's important for financial transparency for therapists, but I currently owe about 150K in loans. But all of that is undergrad and master's. It's a lot, but it's also, like I got a PhD, right? And I got a fully funded one. And so for me, the money piece, I justify it in that way. I know folks though that are 400K in debt because they were not funded or they were partially funded. I know a lot of PsyD programs are not funded. I believe the majority are not funded. And so, you just want to be thoughtful around how money plays into your decision because it is a very important element of the decision-making process. Another reason that a PhD may not be the best idea is if you're someone who knows you want to do full-time private practice. There are lots of people who know that they just want to be clinicians, they don't want to be researchers, they don't want to be professors, and they get really excited about the idea of doing clinical work. And like I said, clinical work doesn't have to be, 40 clients in a week. A full-time clinical caseload usually is about 25 people. And if you're charging a rate that is indicative of your skills and your time and your value, and you are pricing yourself well, then you can have a livable wage with 25 clients, right? You won't be able to do that if you're charging $50 a session, which, there's a lot of different people that are talking about this on social media about pricing yourself right as a therapist, whether you're in network or out of network, and accepting insurance rates. But again, I think that if you are someone who knows you want to do private practice, I don't think you need a PhD for that, right? You can build a very thriving private practice and a group practice if you'd like with just a master's. And so I think it's important for people to be aware of that. And finally, a third reason is you are worried about the impact it's going to have on your time and how you spend, those 5 years. If you are someone, for instance, who wants to have children or wants to start a family, I have a couple of colleagues and friends that have either gotten pregnant during a PhD program or have had kids during a PhD program. And it's very hard, right? And you want to think about, is this a good time for you to pursue a PhD? Or do you want to focus on raising a family, having kids, and then pursuing a PhD? Those 5 years, your energy is primarily going to school. And yes, right, people have lives outside of school, but you have to be able to prioritize, and you will often not have time to do everything. There were many times during the PhD where I had to tell family or I had to tell friends, I can't be there for this thing, right? Or I can't hang out this weekend because I need to work on dissertation. And so again, it's important to just be aware of what your values are, how you like to spend your time, what you want to do with your life. And if you are okay with not making a lot of money during those years, if you are okay with prioritizing school and your education for those 5 years, I think it's just important questions to consider in the decision-making process. So those are the 3 reasons that I would potentially have some hesitancy around starting a PhD. And so that would be money, right? And how expensive it can be to be in a PhD or just having to fund your life during a PhD. Then there is, if you just want to do private practice, I don't necessarily think you need a PhD if you only want to do clinical work. Just being aware that a PhD requires a lot of energy and focus and discipline and motivation. And sometimes things are going to have to come second to your PhD and to your training and to your education. And that could be a deal breaker for people. All right, I hope this was helpful. If you have any questions or anything that you want me to expand on, please feel free to leave a comment. Please subscribe. It would mean a lot for YouTube to also just show this video to more people. There are lots of folks who are interested in PhD and psychology careers, and I think that the more people we have on social media talking about the journey of getting a PhD or the journey of deciding not to get a PhD, PhD, I think that it would just be better for all those folks that have those questions. So with all that being said, I will log off for now, but I will see you all later. Bye.